Path of closure is not straight, but it's not one way either. Go ahead and close again. All right, one more time. He has more tendency of deviation to the right side. Okay, he can fully open, but he has left, right, the path of closure. Either it's muscle imbalance or structural imbalance. Who knows? Okay, go ahead and put your teeth together for me and relax. And one more time. Okay, so masseters on the right hand side is more overactive. Now, if this was a no tension, no pain, any tension, pain, discomfort here? Okay.
No, a little bit more sensation on the right than
There's
the left.
mild myalgia present on the right side. Is that correct? Okay. And it was the only one that was hyperactive too. How about here?
No,
Okay, so the temporalis is non-tender. How about back here, Steve?
no.
Okay. I'm going to check sternocleidomastoid. How about here and here? So I'm going to palpate them separately here.
Yeah, it's not too bad. Right side, I feel more than the left.
So right sternocleidomastoid, and you're grounded on the right side. Okay. How about this temporalis? I'm going to go back and test it again just for verification. Any tension here?
No.
Okay, good. I did. Masseter right side is overactive. Yeah, he's fully grounded here. Like fully, this is where he finds home. This is home. So we're all trying to get him to be like, let's peek into the left side, peek into the left side.
One of the issues is that he's so on his left side. Just from like
Left from a neck down, from a neck, not from the foot. So he doesn't have a foot under him. So we're trying to get his body to feel like safe to get that signal wired up.
yeah.
Change the gait, change the vestibular system. Okay. So Steve, you have any tensions where I have my fingers right here?
No.
Okay, no capsulitis. All right, go ahead and slowly open for me. Okay, that was too fast. Close down. That's okay. Slowly open halfway. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. Keep going, keep going. Okay. Path of closure is not straight, but it's not one way either. Go ahead and close again. All right, one more time. He has more tendency of deviation to the right side. Okay, he can fully open, but he has left, right, the path of closure. Either it's muscle imbalance or structural imbalance. Who knows? Open and close 3 times fast for me. Open all the way and close. Open all the way, close. There's no joint sound. Maybe crepitus, but there's no pop, no click. Okay. All right. Now open as wide as you can. 50 millimeters maximum opening plus. Go ahead and bite down. Okay, he's got, and open really wide. Let me measure your lower teeth. Go ahead and open again. 54, 50 plus 4. Okay, swallow. All right, I'm going to take a look at the back of your throat here. Okay, so open really wide for me. Malampati score is 1. Postnasal drip is evident. Say ah. Uvula stays in the middle. Tongue is lowered on the left side, like it's completely like lower. I look at the shape of the tongue more than anything else there. We have a small minor tori on the maxilla. Mandible has tori as well, lingual. Bite down for me. Okay. So I'm going to take a look at the occlusion. Bite down. He has bicuspid extractions, so premolars are missing. Canine class 1, canine class 1. Overbite and overjet. It's a 4 millimeter here. Go ahead and open again. 5 millimeter overbite, 0 millimeter overjet. Go ahead and bite down again for me. So we have bimaxillary retrusion, so they're both back. All right, smile as big as you can. Okay. Maxilla is higher on the left side and oriented to the left side. Lower midline, 2 millimeter to the left. Okay. Now open really big for me and go ahead and suction your tongue to your palate for me, please. and stay open there. With the tongue suction to the palate, midline still is shifting to the left. Go ahead and relax your tongue. Molar to molar measurement. First molar 35, premolar to premolar 30, and let's see what else. Go ahead and stick your tongue all the way out and to the right ear, to the left ear. The tongue doesn't have any challenge in horizontal movement. The neck doesn't tense up, so there's no restriction of movement. Have you had the tongue release?
No.
Remind me. Okay, good. And suction one more time for me here, Steve. The postnasal drip is very evident, but we have a restriction in the anterior frenum pulling on that point of insertion, which might be contributing to some of that tongue thrusting. It's pulling on the insertion, creating those bumps in the bottom of at the point of attachment.
Right.
So why is your jaw pushing, or tongue pushing, thrusting forward? Is it because it cannot go to the roof of the mouth? Clearly you can.
Right.
Why is it not doing that all the time? Is it the reflex that's pushing it to that, or is it the only way you can properly breathe? And the left side for sure, as we talked about, your sphenoid needs to be positioned. So most of the cranial lesions that I'm seeing, pretty much all of them is on the left.
Right.
So what we need to do is work the mechanics top down. And that concludes my exam. That's it.
Nice.
That's as much as measurement I did. I spent 3 hours on your skull, about 2 minutes in your mouth.
Yeah.
I did already. I've already done that. So, Steve, what I would do is I want to have a quick little chat with Dr. Ryan after what he did, because when the lesion is in your head, we got to treat it. And I got to treat it quick, because we know this is a bilateral, top to bottom, bottom to top, contribution. So if your cranium is off so far that we're trying to make this side and this side equal and get that sphenoid level in the middle, making sure the eyes work, I want to make certain that the exercises he gives you will accommodate a proper sensory-wise your head moving through space as I'm trying to make those changes. Because what I will do is I will challenge your body to drop that sphenoid on that side by virtue of every swallow.
Right.
And I'm trying to get the system moving, getting the face coming forward and tugging on that molar. And once I do, the whole system is going to come unglued, if you will. So the whole dora will respond. If that's a direction that your body will agree to move your head, and I pun intended, meaning that now I have to move my head to the left, which you're avoiding right now. If your sensory is not wiring, it will lock you back up. This is why over the years I've learned we've got to make the nervous system and the sensory integration in agreement. What Josh does is a huge part of it, obviously, because your rib cage supports your head, but also sensory-wise. Those are outside of my personal expertise, but that's why we're doing it in the direction.
For sure.
So yesterday, if you remember, when I put the block on this left side, you're like, oh, I found the ground underneath of me. And that's what it would be. So during the day, you would wear an appliance that's going to have just those millimeters of block in there. And you walk around with it, you do the exercises, and you retrain your neck. And at night, you're going to wear the upper, where without the ground, we're working only on the skull changes. Because every time you swallow without the ground, forcing things from the ground up, I have a chance to change, especially when you're here, the fluids inside the cranium. Because if you think about it, there's fluid around the tentorium, top and bottom. So when you're fighting with gravity, the gravity pulling the side that's down even further. But at night, that's not the case. Especially, I'm starting to think like a lot of our adjustments should be done here, because then gravity pulls the fluids the right direction. So we're trying to level that maxilla as we're trying to level the body. So where the two meet, I have no idea where your teeth are going to meet. But I know that we're moving them together. We're moving the bus, your teeth are people sitting on the bus. So we're moving the cranial structures in 3D, putting them in where it makes sense for breathing, sensory integrations, standing up, power generations, alignment, name it. We are not focused on your occlusion. And the reason why I'm saying that is we might be done. I'm not creating space between your teeth. I am not expanding you. It's not that. I have no clue where your teeth are going to wind up when said and done, especially that the orthodontist created a space I'm trying to break. I'm breaking that occlusion. I'm eliminating that information to your head. So now we're basically leveling the head, pun intended, with the ears, getting the atlas to follow us, removing the adhesions in your spine, getting your spine to move without this ill information from your teeth. Once we break that cycle, other than chewing, you probably will not be wearing these appliances. You're going to take it out of your mouth, walk around with it, put it back in. Other than the times that you're eating, like I said, your teeth are not going to meet up. As a matter of fact, when you eat, your teeth don't touch.
Right.
They touch only when you swallow. So all this swallow correction will tell your brain, okay, cerebellum, this is the direction we want you to go.
Right.
And did Dr. Ryan did another testing with the popsicle stick?
We did both sides.
And which one improved it?
The popsicle on the right side I did better. The popsicle on the left side I did worse.
Well, like I said, I know in fact when I test you with the popsicle and standing on the right, everything on the left side, it improves that cranial lesion. Let me talk to him because
Sure.
where with the plug on the bottom, it has no bearing on your cranium for the most part.
Sure.
To a great degree, it just shifts and moves the lower jaw. The top is the more important one. And I purely use the CBCT for that. Everything I tested here tested better on the block on the left and not on the right. But because, like I said, the block is meant to just get your mandible in a new position.
Sure.
And it's working off of that.
Yeah.
And I want to see what his testing is telling me because I want to factor that in.
Yeah. I remembered with Dr. Pearson yesterday, I want to say it was on the right side, that I stood better on the left leg.
Let's test it again.
But
You're here and I'm here now. Yeah. Alrighty. So perfect. Your feet are nice and straight. Let's go. Hold firm. Hold firm. Hold firm. Okay, so that's your power. Let's see where you get it. Stand on the right foot, and you can perfectly ground it. Okay. Left foot, and swallow. Okay. See what changed from yesterday? You already improved one adjustment.
right.
You're not the same person you were yesterday.
That's crazy.
Isn't it so? I was there. I have it all on camera.
Yeah, I
Do you
know.
see? Do you see how quickly
Right.
things move?
Yeah.
Which
My
is
left
what.
hamstring would cramp up just holding the seated
This
position.
is one of the reasons why I'm like, I know that I'm not so hung up on the lower. I might not just even put a block in it. I just give you a block where I need to give you a block.
Sure.
And this is what I love about our appliances is I'm the artist.
Right.
I just see what your body needs. Because look, stand on that left foot. Okay. Did Ryan do any exercises too?
Just the
I
vestibular.
mean, check you out.
Yeah.
Do you believe this?
Yeah,
Like
it's crazy.
yesterday was.
I was all over the place.
I know. Good. Look straight ahead. All right. Okay. Push against me here. Okay. Push against me. See how that gets weak?
Yeah, a little bit.
Right. So I'm going to challenge it further.
Okay.
Okay. Look straight ahead. Push against me there. Comparing that power to put your teeth together for me to this power. So that's weak.
Yeah.
That was my thinking that if I whoop my little tongue at the roof, please, and bite down and open. Okay, first of all, swallow. Okay, and close your eyes first. Suction your tongue to the roof of your mouth, open really big, and now bite down. Okay, there you go. All right, now open your eyes, look straight ahead. Let's see. Perfect. Push against me again, push against me. Perfect. Now I'm going to challenge that left foot and stand on that left foot. From a strength standpoint, that's where I would support you. Now, let's check your balance over here. So tilt your head here and push against me. Your atlas was to the left. Did he adjust your atlas yesterday? I don't think he did. You didn't check your neck. Okay.
Yeah.
Your atlas is still where it was before. A little weaker. Swallow. Put your head to the left. Okay, push against me. By far a lot weaker.
Yep.
It's okay, head straight, suction tongue, and bite. Tilt your head to this side, push against me. Tilt your head back, push against me. Tilt your head forward, push against me. To the other side. So when you have the appliance with my block, as you move through space, this gives you the sense of the ground that you need.
Okay.
Now, what Ryan does, it basically checks and see what the electric signals are. So if we must make the changes when you're not walking at night, that's the only thing I want to see. Is this going to make it better or worse? This is unreal. Like yet last night, literally last night, he couldn't stand on that foot.
No.
One adjustment, 24 hours wearing the belt,
Yeah.
and one exercise. His brain is like, oh, I have a better perception. This left side is not a bad place to hang out.
Yeah.
And you haven't been visiting that space for a long time. It's like you have a 4-bedroom home, but you're living in the kitchen. It's like, dude, you got 4 more rooms. You could
Right.
you're like, this life actually feels better.
Right.
When people tell me I can sleep better, it's because your body is accessing all of its spaces.
Right.
You know, but sensory-wise, we got to wire it first, which is why I'm like, what did he see? Which signal is coming from where?
Sure.
And why would this make it improve? Because if I put this block here, Again, you're not the same person as you were last night. Look straight ahead. Okay, push against me there. You can take your power away. Put your head to the right side and put your head to the left side. So I would not treat your mouth on that side.
Yeah.
Not saying that it's wrong, but those metrics are telling me something. Because what happens is, Steve, a lot of times the place I want to move you to is where I know is going to be better for you. But your nervous system is wired to what it knows. So when I put this block here, it goes, I'm not so sure. Let me just go and ground myself to what I know.
Right.
That's your nervous system. That's your system pulling you that direction. So maybe it would make sense to do the exercises with the appliance in your mouth to force your body to say, this is who I want to become.
Sure.
You following me?
Yeah.
Trust me.
Introducing it. Like, hey, it's safe.
I mean, 99% of the time when I put the block in there and put you back on that system, voltage goes from 600 to 1200, the nervous system improves. I've had patients that actually, when they get a couple of things that challenges their stuck nervous system, reflexes, we put them back on the machine, they're in full-on sympathetic. We're like, what just happened? It's like, okay, you're stuck in the middle, you're not going left, you're not going to the right, right? That's the stuck. We challenge the nervous system, break the habits and go, let me push you to sympathetic, okay?
Right.
You're not going to go back to where you were. Where do you want to be? Now you have a chance to change it. Where would you want to go? Sometimes it's a good thing to put you in a sympathetic, because from sympathetic, you can swing back to parasympathetic. In a dorsal vagal here in the middle, play dead. You can't be either one. You're playing dead. You're not good. You're not bad. You're indifferent.
You're just in the middle.
Exactly.
Yeah.
And it just very well so turns on the sympathetic, because it signals your brain that we're still not safe. We're just playing dead.
Right.
It's the worst.
Yeah.
So if I'm getting a sympathetic response, that's a good news for me. From where I see the world, I'd like you to be challenged, because in challenge, I can give you a new place to go. It's like, okay, now our goal is to stick that landing in 3D, okay? Can you find that ground? Can you coordinate it with your ears? Can you, in fact, breathe in there? Okay, then let's practice and rehearse that. 2,000 swallows later, that becomes your new norm.
Right.
So we're challenging your norm. That's the only way I can explain that, because everything else is still checking left side. So I won't change that. Left side block, how many millimeters? I think this is a good place to be, because we're having fun. Let's add a little bit, because we're dentists, right?
Sure.
More is better. Just want you to see just one more popsicle stick. All right. That's where you were, by the way, with the other appliance.
Okay.
All right, let's go. Push against me there. Same side, just incorrect amount of space.
Yeah.
You just need barely a separation. Open big, tongue suction tongue, and bite down. Okay, let me check you both sides. Push against me there. Perfect. Tilt your head to the left. Push against me. To the right. Push against me. Okay, stand on the left foot. Check you out. No, stand on the left foot. Tilt your head to the left. To the right. Tilt your head to the right. Okay, I can see your ankle is being challenged too, which is good.
Yeah.
You're like, oh yeah, let's go. Let's find that. You're getting off the toe.
Yeah.
Just a popsicle stick.
Just that much.
You know, people say, what kind of device you want to use? I don't know, 3 marbles and a sing kumbaya. That's right. That's it. That's your space. So, all right, go ahead and open again. Bite down. All right. Now, I'm just going to throw in another monkey wrench. Push your jaw a little forward. Okay, and open again. And there we go. Let me close you down. There you go. This is where the protrusion comes in, okay? I'm just checking. We already know what things are. All right, push against me there. Stand on that left foot. That's what protrusion does. And that's where you were with the last appliance, because it takes with it everything in it, neck. So what is a physiological place? Which is why I have patients take a 3 deep breath. This is my protocol. 3 deep breath through your nose. Out. One more. Out. One more. Good. Close your eyes. 1 swallow. Suction your tongue. Open big. And bite. That's your home. Open your eyes. Look straight ahead. Now I want to challenge you. Close your eyes and stand on the left foot. 2 out of 3 adds up. You have a little bit more challenge. So I have sound. I'm talking to you. I'm challenging you. Stand up. I want to take the eyes away. Vestibulars are aligned with the foot, with the mouth. Okay, this is a good day for me.
Yeah.
Don't. That's it. Get scared.
Oh, cool.
I'm like, we're not doing all that again. Just don't move it. She's going to scan you.
Cool.
So Steve, I was showing this to Dr. Ryan because I think what's happening here, because it said when some of the metrics you see, because you check sacules, right? Did they say it right? And ventricles. So when your ears and eyes are moving to the direction we want to go, what happens is his cerebellum has to be like, okay, so you just changed the position of the mouth. I have to make sense of. He said, your metrics kind of were less improved. And this is the only first time that happened, but I'm like, we're learning something because last night we were challenging his nervous system. I told you, he couldn't stand on the left leg. There's no belt here, is there? No. Okay, so watch. Hold firm. Okay, stand on the left leg. No problem. Just one adjustment and 24 hours, just simulation. His nervous system is like, okay, this could happen if this is working. So that turned off. And from top down also was weak. So lateralize on here. Perfect. So go ahead and just look straight ahead for me. Good. Push against me here. So there's weakness on that side. So I'm just going to use your tongue. Put your tongue between left side teeth. Good. Okay. See how this is stronger? Put your tongue between right side teeth. Okay. Now let's go. From my world, gets weaker. So if he were to, like he's running, like if you're in an anxious situation, you want to get yourself down to, you stick your tongue to the left side. You do that anyway. You catch yourself, you're like, oh my gosh. That's the side.
It's the same thing like Michael Jordan. Why
Exactly.
does he always do that?
Because he gets himself into parasympathetic, because he balances himself. Tongue is right.
Exactly.
Tongue is the only organ you have. You don't have a diaphragm, that's your tongue. You don't have a neck, neck is your tongue. You don't have a proper occlusion, tongue will fill a gap. Like tongue is your filler.
Yeah.
But now I'm looking at him and just saying, okay, the eye, there's a cranial lesion on the left side, which we would be challenging with the appliance. Everything goes on the left side. I want to know what metrics was not improved, because only way, Ryan, I think I can explain this because we're learning with you guys, is that everyone that improves with the popsicle stick is because they have a pattern. So we're shifting them between the pattern and zigzags. You're lateralized. Your spine is only referencing one side. So what I'm doing with that is challenging him to now coordinate. He's never had coordination between eyes, within the ears, with the heel seats, with anything here. So now the brain is like, let's go to the left. Your system probably is saying, maybe I'm safer here. How long does it take to crank through that reticular patterning? We're to see. But I would say it would be safe to see. Let's do the exercises with the appliance in your mouth and without the appliance in your mouth and see what happens. Because if I'm giving him a ground here and say, let's coordinate all of those exercises, get the cerebellum, every information we can, from the mouth, from the eyes, from hearing, neck, right?
Yeah, right.
Okay, let's get an adjustment on the atlas at the proper time and move the atlas when your senses are no longer shoving it back over.
Right.
Let's see how long it takes to stay. Do you really have upper cervical instability, or your body locks up the neck that cannot sense? If we improve the senses and structure, do you really have an upper cervical instability? Because I think either it gets no diagnosis or full and everybody's a CCI.
Right.
Like, okay, he cannot find his ground, but not because his ligaments are loose, but because his senses are not working. Like the Bible says, the man without a sense.
Right.
I look down in the book of
senses
Proverbs, it
back
goes,
on.
the sense is back on. It goes, that was a man without a sense. We're going to get you a sense. And some of the patients that I learned the most from, Mark Jackson, literally if I would give him a snap, he turns his eye, catatonic on the floor.
There it is.
Why? Because his brain does not know left side. He is you on a steroid.
Wow.
Oh yeah, the optokinetics.
Yeah.
When the lines moved to the left, literally eyes went up and like he just stopped breathing.
Wow.
To the right, completely fine. Same story.
Because he's stuck on the right.
Yeah.
To get this guy, we had to literally give him the block on the right and getting his fluids to gently move, the fluid in the brain, the CSF, to move the door, cranially pattern.
Sure.
And he's doing wonderful. But in your case, again, I checked him, the strength stance was the stronger here. Do I have two people with the same pattern respond to the same treatment? I'm yet to see it.
Like I was saying, it's just.
And I have taken the block away, added it back over. This is why I love the flexibility.
Yep.
I wish I had all the answers.
Right.
Same thing with some of the exercises. There's exercises that you need that I know you need. You're not ready for them yet.
Right. We'll build that.
We'll get to there.
Yeah.
You know, so because if I do an exercise like we did the T-bobbers, okay, you don't have that on your plan because you're not ready for it yet.
Right.
Okay.
Yeah.
Eventually you will be, but it's just too much.
Yeah.
Same thing with the oral appliance and the exercises. That combination might be too much for the brain. I would
the same
prefer
No
separate.
appliance. Yep.
Yeah.
So just during the exercises, afterwards throw it in.
Right.
Just during the exercises,
Take 'em out.
I want your brain to just focus on what we're doing. Same thing with like, you know how you did the rotation with the figure eight?
Yep.
Or we did a bunch of other combinations with all that stuff.
Yep.
Sometimes people's brains need it separate.
Yeah.
Sometimes people's brains need it together. Okay.
Right.
You needed both. Okay.
Yeah.
Like the jaw figure eights that we're doing with the vibration.
Yep.
Okay. You need that on its own, but you also needed it with that T down bobber.
Yeah.
Okay.
Right.
So everybody's just so different,
For
and I
sure.
just don't want to tank your brain. That's
Yeah.
the biggest thing.
Because the more we do, the more energy expenditure we're going to put you in. Because every time you're trying to learn something new, your brain has to exert itself.
Right.
Hence why I see a lot of times the sympathetic turns on is like, I'm maxed out. I can't learn anything new today. He just had a major pelvic orientation change yesterday.
Yeah.
I mean,
Yeah,
my
he's
God,
incredible.
you remember Anna was like, Bahar, are you sure you want to get an adjustment? That's why.
Yeah.
Because
my
we've seen
left
it.
hamstring would
You-
literally cramp up just in a seated position, trying to sit on one leg.
Yeah.
And then on the standing,
Yep.
I crumbled on the left leg.
Yeah.
Yeah.
And yeah, the
Isn't it
adjustment,
amazing?
it's crazy.
Amazing.
Yeah, I mean, I know from the squatting injury I had, that's probably been something that has been working its way.
You know, I
up
think
and down, but-
the imbalance led you to, and that one compact injury basically pushed you into that state. So body's constantly trying to guard this, which is why when we unguarded it, he goes, well, maybe left side is an option.
Sure.
I'm not so sure about that yet.
Right.
Because your brain intentionally will turn things off, and your mouth has only one job to do. Every time you swallow, report back to the brain, how's the state of everybody? How's everyone
Sure.
doing? So when mouth is telling the brain, we're not doing so good, it basically constantly keeps you in that anxiety mode. And it exacerbates. So what do? Avoid it first.
Yeah.
If it hurts, I would avoid it. Then I want to cover it. I'm going to overuse my serotonin, descending pathway. I don't know it's there. And then you incur another injury because you're not a whole person. You're making yourself look like you're a whole person because you're surviving.
Right.
And then you shift back over to it's like, oh, that good old pain.
Right.
I can't mask it anymore. I'm running out of serotonin. My gut's not making it anymore. I'm living in sympathetic. So what's your brain going to think and do? Why don't we just make everything hurt?
Yeah.
Why don't we just neuroplastically change the level of pain? So if everything hurts, then I don't notice that anymore.
Right.
It's stupid. But now you're living in a state of constant pain, fibromyalgia.
Yeah.
I mean, I have to honestly believe all the state of the incoherence that we're living in is a sequence of the brain trying to figure out how I can make it to the next breath. What do I need to contort to? I'm constantly exerting myself. How do I move through space? Maybe I should just be on the floor. Maybe it's better that
It's
way.
trying to keep you alive.
Just to
Yeah.
stay alive
Survival.
And
until you
sometimes
die.
It's amazing, and sometimes it's really bad for us.
Right.
You know?
Yeah.
So,
Yeah, survival becomes a mode of operation. Survival at the time you were under a squad rack, to shut you down was a perfect thing. Thank you, body, for saving me.
Right.
That was a good reflex. But you know what? I'm not in that mode anymore. Let me fix it. If the brain is like, yeah, no, I'm not so sure that I'm not so sure we're safe.
Prove it.
Prove it.
Yeah.
Like I said, this is a test within 24 hours. Remember I told you, within 24 hours, I know if our phase one is going to work. If a patient is becoming non-responsive here, I'm not touching the upper DNA, lower DNA, none of that.
Yeah.
Because the minute I start changing and snooking things around, the brain goes, well,
Yeah.
about that.
Right.
I told you, I buckled myself here because I'm not safe. And if the brain perception of safety hasn't changed, whatever change we make in the body is going to defy what it already knows. It's like, maybe I should lock up even harder.
Right.
Harder. Maybe I should hang on harder.
Yeah.
And I see that too. So
it is interesting too with the injury was during a squat, correct?
Correct. Yeah.
That's a sacral exercise. You have two of them. Okay.
Yeah.
So it's possible too that with that injury, it just kind of like damaged that vestibular system too, or you just might be kind of nervous about this kind of motion.
Yeah.
And your brain's compensating.
Sure.
So I don't know that for sure, but it's interesting that that's what happened, and that's one of your main findings is that sacral.
Right.
So
Yeah, for sure.
I do got to get back to Josh.
thank
but-
you.
Yeah,
Good
for
seeing
sure.
you. Okay.
Thank you.
Okay. I just wanted the feedback from him because I didn't
Yeah.
know what part, and that totally makes sense because that's a pitch distortion.
Okay.
What you see is a pitch distortion. That's why for him, because I'm not even getting to the pitch correction until the very end. So what I would say is we will see you again. I will order your appliance. I think I should have it by October-ish sometimes. So we'll see you again. We're going to deliver it and see how it goes. Goes on
Awesome.
the left. If I forget, because I'm dyslexic, both on the left.
Got you.
Just
All right. Yeah,
How's
it's
it
all
played?
those things. Thank you so much, Dr.
So good to
Smiley.
see
So good
you.
to see you.
It's good to
Thank
see
you for
you.
everything.